Today I saw EG, who is a 16-year-old Hispanic male who presented to the clinic for lower back pain. He's had lower back pain for one day. He reports that he ran into somebody after he was getting a rebound during a game of basketball. He rated his pain currently at a 9 out of 10. He reports it being sore and achy, located primarily on the right lower back. He reports that the pain becomes sharp and worse when he's sitting, bending, or twisting. He denies any radiation of the pain. Lying flat on his back and using ice makes the pain better, and he denies any use of any over-the-counter pain or anti-inflammatory meds. He also denies pain with breathing, BMs, or urination. So upon review of past medical history, he denies current or previous health problems, illnesses, or injuries other than his current complaint. He denies surgeries, procedures, or hospitalizations. He is currently in the 11th grade at Sheridan High School. He plays in the school's varsity basketball team. He denies use of marijuana, drugs, or alcohol. He lives at home with mom, dad, and brother. He does not currently take any medication, vitamins, or herbs. He has no known drug, food, or seasonal allergies, and he denies any significant family and medical history. Upon review of systems, starting with musculoskeletal, other than the new lower back pain, he denies any other tenderness, swelling, muscle cramps, joint stiffness, neck or shoulder pain, or range of motion limitations at this time. Respiratory-wise, he denies shortness of breath, cough, dyspnea, wheezing, and hemoptysis. He denies chest pain, dizziness, lightheadedness, orthopnea, and palpitation. GI denies nausea, vomiting, diarrhea, constipation, or dark bloody stools. GU-wise denies change with urination, denies dysuria or hematuria, and neuro denies change in sensation, numbness, or tingling in all extremities. For differential diagnoses, I went ahead and decided upon lumbar strain, herniated disc, or lumbar compression fracture, and in order to get to the final diagnosis, I needed to proceed with a physical exam. So upon physical exam, starting with musculoskeletal, normal stability and gait, he had some slight redness and warmth on the right lower back. Lumbar spine was symmetrical. Forward flexion was limited to about 70 degrees before reporting pain. Right lower back is tender to palpation. He has 5 out of 5 strength and full range of motion in neck, shoulders, arms, legs, and feet. Respiratory-wise, no thoracic asymmetry was noted. Respiratory excursion was normal and symmetric. Lungs were clear to auscultation bilaterally, and no adventitious breath sounds were heard. Cardiac-wise, S1 and S2 were regular in rate and rhythm. No S3, S4, or murmurs. Normal cap refill time. 2+ radial and dorsalis pedis pulses. Neuro, he was alert and oriented ×4. Sensation was equal bilaterally in upper and lower extremities. GI was soft, non-tender. Bowel sounds were present in all 4 quadrants. No diagnostic labs or imaging were needed at this time, so I went ahead and based my diagnosis on the physical exam findings and the review of systems, and I would diagnose him with a lumbar strain. So for his treatment plan, I went ahead and instructed him to continue with the application of ice packs for his lower back for relief of pain as needed. I also went ahead and told him to take ibuprofen 400 milligrams orally every 4 to 6 hours as needed for pain. I also told him not to exceed more than 3,200 milligrams per day, divided into 3 or 4 equal doses. I also told him that to take it with food or drink to reduce any chance of upset stomach. Avoid lifting more than 20 pounds in any activities where bending, twisting, or potential physical contact might occur for the next 2 to 3 weeks. I also told him that lower back muscle strains typically heal within 3 to 4 weeks, so if he was still having any lower back pain in the next 3 to 4 weeks, I wanted him to return to the clinic. I also instructed him to return to the clinic sooner if the pain worsened or radiated to another body part, or there was any decrease in sensation, numbness, tingling in his legs, or pain with BMs or urination that occurred. So moving on to the special sections, section C, thoroughly describe the setting the patient encounter occurred in. So my patient was seen at the Sheridan Youth Health Clinic, which is a school-based primary care clinic. It's staffed by providers from the University of Colorado College of Nursing. It also provides behavioral health, dental care, and pharmacy services. Question number 2, describe the typical patient population served in this setting. The typical patient population consists of children from birth to 18 years old, and they generally come from households of lower socioeconomic status. Question 3, thoroughly describe the health disparities faced by the population served in this setting. What impacts have these health disparities had on the pediatric patient's growth, development, and social function? So families of low socioeconomic status face many health disparities, one being poor health outcomes due to a lack of resources, low health literacy, and healthcare costs. These disparities may lead to a delay in the pediatric patient obtaining healthcare services due to financial issues, lacks of accessibility, or support from caregivers. The lack of healthcare with this population can result in development of chronic illnesses due to not receiving preventative care, or a chance of contracting diseases due to a lack of immunizations and a lack of screening for abuse and behavioral health issues. The goal of the Sheridan Health Youth Clinic is to make healthcare and medical resources more accessible to children who might otherwise have barriers for seeking medical attention. By having the clinic in a school, it makes receiving medical care more convenient and increases the likelihood that the children will seek medical attention. As a result of the clinic being easily accessible, my patient was able to have his healthcare needs addressed within 24 hours of his back injury by coming in during a break between his classes. This should result in a quicker healing process due to recommendations provided to him. And that's my pediatric clinical case presentation. Thank you.